Are you teaching other doctors, or are you teaching the public, or are you teaching both?
I would say both. Really what we have done from a physician standpoint, obviously we've tried to really focus on our physicians at our clinics so that they're able to provide the best care possible. However, we've absolutely participated in other physician or provider educational programs or services, and then we also do a whole bunch of community or grassroots education as well. We just had a special event not too long ago for veterans downtown where we were able to do some certifications for free for veterans to help them out. So really we try to work with the community as closely as we can.
Again, folks, if you have a question, the doctor is going to be with us for about 15 more minutes, 283-2525, 283-2525. It's a free phone call, and if you don't want to give your name, that's quite all right. We can still get the question across. If you want to go on the air with us, we can do that as well. If you have a condition that you're wondering about, if you're wondering how this whole process works, if you're wondering about the cards, please feel free and give us a call. It's a free call, and the doctor is right here with us. So 283-2525. And speaking of the cards, Dr. Donner, how do you make sure that the cards are not being misused, whether it's by, two people who look like each other, whether it's by somebody with the same name, maybe it's a younger person versus an elderly person? I mean, how do you prevent cards being misused?
Yes, I think, Tracy, preventing diversion was a really big priority for the Department of Health, and I think the way they built their system is very good, and there's some redundancies sort of built in. So the first thing that ends up happening is the state program is the medical marijuana program. It's directly linked to PennDOT or the Department of Transportation. So whenever a patient in order to get a Pennsylvania medical marijuana card, a patient will need to have one of two things: either A, Pennsylvania driver's license, or B, a Pennsylvania state identification card. Once they have one of those, then essentially what's happening on the patient's medical marijuana card, their picture or their photo ID will be pulled from the PennDOT system and inserted onto their medical marijuana identification card. So then whenever the patient once they receive that card and they go to the dispensary, once they get to the dispensary, they're required to not only show their medical marijuana identification card, which has their picture on it, but they're also required to show their state-issued ID, whether it's a driver's license or just the ID card. Those are then confirmed, and then the medical marijuana card is also confirmed in the state's internal system to make sure that it's active and appropriate. Then on a final end, when the patient goes into the dispensary, when they're actually going to get their medications, once again their medical card is confirmed. So really on multiple levels, there's been some fail-safes that have been created to help prevent diversion, and in my opinion, I think it's been very effective so far.
Okay, a couple of questions when you talk about the license. What happens if you don't have a license?
So if you don't have a Pennsylvania state driver's license, then you would need to get a Pennsylvania state identification card.
Okay.
And this holds true for anybody who's 18 years or older. Pediatric patients are a little bit different because they have a caregiver. But if you're an adult patient, you either need to have a PA state driver's license or a PA state identification card.
So then what happens, let's say we go on vacation or we spend the winter months in Florida. I mean, a lot of people do it.
Yes.
Or go to a different state. I don't mean to pick on Florida, but just that you're out of the area for like 6 or 8 months. Can you still use your Pennsylvania license, or what do you do when you're in a different state?
This is a wonderful question, something we call, we term reciprocity. And the answer, when we're talking, Tracy, it's really not cut and dry. So I would say this. First, based off of the federal law currently in the United States, that if any patient, even if you have a medical marijuana identification card, if you take that medication across state lines, technically that could be a federal offense, even if you are going from a state with a medical marijuana program into another state with a medical marijuana program. So our recommendation to our patients is that they do not take their medications with them when they're traveling across state lines. As an alternative to that, what we oftentimes will recommend is that the patient look into the state that they're going to see if that state, number one, has a medical marijuana program, and then if they do, some states offer what is called reciprocity. So, for example, if you went to, say, up to Michigan, and you went into a dispensary in Michigan, they would accept your Pennsylvania medical marijuana card. However, these rules are or laws are from state to state to state and vary. So my recommendation to patients, if you're traveling out of state, don't take your medication with you. Find out if that state has an active medical marijuana program. If they do, simply contact one of their dispensaries in that state and ask them if they will accept your Pennsylvania medical marijuana card.
Way back when I started in this industry, somebody said, just keep it simple, keep it simple, keep it simple. It just does not seem like when I talk to you, doctor, that this conversation is simple. And I'm wondering if that's what's causing some confusion and it's just hard to understand.
It sure is, Tracy. You're absolutely right, and it's hard to understand on multiple levels. And I think you even look at somebody, myself, who I've been immersed in this industry for the last 3 to 4 years, and there's still oftentimes gray area, and there can't be definitive questions. So I think when you look at our state's program, I think they've done a very good job. Better than even anticipated, but there's some pitfalls, right? So, for example, the whole process is done online, so you have to have access to a computer and the internet. You also have to have an email address. So if you're, some of our elderly patients, that's not practical for them. So I think you see some of the sort of practical or logistical things come to light as time moves on, but they're being tweaked as we go, which is important.
And as in anything, when it's new, you have to work out the bugs. How new is this conversation? Is it a year old, 5 years old? Because for some of us, we're just waking up to this and just realizing that this is something that maybe we could go down. Even though it's been in the news, we don't pay attention to it until we are the ones who want to go and actually take advantage of the services.
That's absolutely.
Yeah,
Sorry,
go ahead.
I didn't mean
you go ahead.
But no, I think that's absolutely correct. And I oftentimes when I'm speaking to people, I will tell them that to keep in mind that oftentimes we get caught looking at just sort of Pennsylvania. That's just one microcosm of sort of the cannabis movement that I would say that's happening globally now. So whenever you look at sort of the timing from this, I think it's different depending on what part of the country you live in, what state you live in. For example, if you're from California or if you're from the state of Washington, I think that you've seen things progress much more quickly, and there's been some time now versus I think on a lot of the East Coast states you see this is brand new. It's really in Pennsylvania pretty much a year old. So you see quite some variability from state to state across the country.
And I want to ask you about your center here in Butler in just a moment. One more question about the license, though, because you say it goes through PennDOT or it goes online. You have to have that email address. How about the information and it being shared? Is it kept secret? Is it, I'm wondering if I go to a dispensary and I have my card and I'm wondering how much information is being shared of the products that I'm actually buying.
Great question. And to answer yes, your information is protected. So this is treated just like any other healthcare or medical patient medical information and protected under HIPAA and those type of laws and regulations. So really the only people that have access to either A, knowing that you have a medical marijuana identification card, and then B, also the medications that you would take would be the Department of Health. So patients are not listed on, like, for example, the JNet, law enforcement database. So really, it's private and protected healthcare information, so that's not being shared.
And are you restricted on how much you can buy? I'm wondering if there are restrictions on, I want to go buy a plethora and then share it with people, versus me being able to be the one using the product.
Yes, there is, and there are limits, sort of a monthly limit that's tracked by the dispensaries. To be frank with you, I've had some sort of varying answers on that number, so I don't want to give anything specific sort of on the air. But yes, there is a limit, and that's also tracked. So, for example, I can tell you of a case in the past where we had a patient that was going into the dispensary very frequently and buying large amounts. At that point, the Department of Health was alerted, and then corrective measures we're taking. So it absolutely is tracked.
Dr. Brian Donner with us, the co-founder of Compassionate Certification Centers. 5 minutes left. left if you want to get that question in, if you're wondering. 283-2525, 283-2525. Of course, we have one of the centers right here in Butler, and I say one of them because you have quite a few centers, but this one is at 127 East Cunningham Street in Butler. When we go, tell us what we should expect. I mean, you're traveling a bit. You're at the center sometimes, but who is your staff? Who should we expect to see when we walk in?
Absolutely. And I think one of the things I want, every patients who come to see us naturally are very anxious and nervous. The process is somewhat unknown, and I think it just causes people some anxiety. Really what we have tried to do is design our offices to be very similar to any other physician's office. So where it's very welcoming, so that whenever a patient comes into our office, they'll be able to immediately talk to an office manager or an administrator about getting checked in for their appointment. They're then taken through an intake process with our nursing or clinical staff that will go through their medications, their medical history, their qualifying condition. Then after that, the patient will actually have their time with the doctor where again, they're going to be interviewed. The medical marijuana program will be explained. A treatment program will be outlined. And then we make sure that obviously any follow-up is scheduled at that point as well. In addition, at our clinics, we have our own brand of hemp-derived CBD. So you're able to come in there, even if you're not a patient and interested in getting your medical marijuana card, you just have some questions or you want to learn about the state program or CBD, come into any of our offices anytime, and our staff will be happy to answer your questions and walk through everything with you.
Do you have any advice for those who are starting into this process on how they handle other people, the skepticism, the false narratives that may be out there, the stigma that is out there? Because a lot of folks are doing this for their health. I mean, that's why they're doing this. And yet they walk out into society, and some people just don't understand that process.
Absolutely, and the way I encourage my patients to be as forthcoming about this as possible. But really, some of the greatest change that I have seen when you're talking about medical cannabis are when patients tell other patients. And I can't tell you how many patients come into our office and hey, my aunt told me about this, or my friend is having good results from this, or hey, I had a family member in California who's really had good results with medical marijuana. So I really think that patients should tell other folks about the positive results that they had, and then the lack of the negative results that go with it. Really, that's how the stigma is ended, more or less, than anything else. And I tell people as well, remember that above all else, most important is your own health and your own well-being. And if this is a medication that's something that can help you, then that's nothing to be ashamed of. It's something to let others know, because you may be able to help that other person, and it may be just around the corner and you didn't even know it.
For those folks who are on a regimen of medications from their doctors, do you see the cannabis therapy, the medical marijuana, fix conditions, or are people getting off of the medications that their PCPs are giving them, or is it helping them in their health?
I would say yes to answer all of those. It's absolutely helping in their health, and I have seen patients being able to get off a number of medications with medical marijuana. I think you look at, obviously, the pain medications, whether those are opiates or anti-inflammatories. I think when you look at some of the anti-epileptic medications, I think from PTSD, some of the psychotropic medications, we've seen evidence clinically that patients are able to use medical cannabis in lieu of those medications, and often get off of those medications as well. So that's absolutely a possibility, and something that we're seeing real time every day.
Compassionate Certification Centers, of course, ours here in Butler is 127 East Cunningham Street in Butler. Are these walk-ins or are these appointments?
We do both, Tracy. Okay. You're able to, you can call and make an appointment ahead of time if you want. You're able to go on our website and do self-scheduling if you prefer, or you could also just walk in at any time, and at that point we could either see you right then, or alternatively set up an actual dedicated appointment. So any of those options are completely fine, and we're always staffed. We can help walk patients through from start to finish. So I don't want patients to be concerned about not knowing what to do. We can help them, walk them through that process as well.
And folks, if you want to ask Alexa, of course, you can always ask her what the address is. But if you want to look it up yourself, it's CompassionateCertificationCenters.com. And the East Cunningham Street address is 127. It's Suite 101 in Butler. And the 888 number is 316-90 85, and that's a free call. It's just 888. So, Dr. Donner, thank you so much for being with us again. We hope to talk to you again sometime here in the future, but we appreciate it, and we'll just continue the conversation.
Always a pleasure, Tracy. I appreciate you guys taking the time and having me on.
Thank you. And folks, thank you very much for joining us for this segment. We are out of time, but if you would like to listen to this program again, just go back on our website at WISR680.com. Pick programs, let's talk, and then look for that one-time only kind of section, that unique folder that we have for these kinds of programs, and you'll find it there. I'm Tracey Morgan with Let's Talk.
The information and opinions shared on this program are solely those of our guests and do not necessarily represent those of WISR, the Butler County Radio Network, or its staff and employees.